Hi, I'm Jeff Blumberg, and I'm the Chief Operating Officer at MGE. And for this week's tip, we're going to talk about why some patients think that dentists over-diagnose. Now, I know the word over-diagnose or over-diagnosis isn't really a word. It's a bit of a made-up word. If we were to say it another way, it would be why some patients think that dentists recommend treatment that people don't need. This idea of over-diagnosing has been around for quite some time. If you've been around for any length of time, you might even remember in 1997, the article in Reader's Digest called How Honest Are Dentists, where it talked about this very thing. If you do happen to look at it, I do recommend that you read Dr. Levin's response to it, which was excellent, in Dental Economics. And for you young people who may not be familiar with Reader's Digest, it's a magazine. It used to be very popular. It is not a probiotic. In any event, this idea has shown itself at various points in time over the last 20 years, various magazine articles or whatnot, or TV exposés. And for that matter, you'll find it quite a bit in negative reviews that you see about dentists online. And interesting thing about negative reviews, when I look at them, and I've probably looked at, I would have to estimate at least 2,000 or 3,000 negative reviews about dentists. The majority of them don't revolve around actual treatment. In other words, they're not, I went to this dentist and his or her treatment was bad. That's not normally what they revolve around. They revolve around three things. One is customer service issues. The other is financial issues. My insurance didn't cover this or that. And the last has to do with treatment planning or treatment communication and acceptance. Those are the main areas where you see these negative responses online. So we have this issue of treatment planning and acceptance. And again, when you see those, how do those normally read? I went to Dr. So-and-so's office. I thought I just needed a cleaning. And then Dr. So-and-so told me I needed $3,000 or $4,000 worth of treatment. Don't go to this place. It's a scam. You see that same argument, that same thread flowing through these negative reviews. So let's take a look at this issue for a second. And I should give you a little disclaimer. I am not a dentist, so I am not in any position to weigh in clinically on any form of diagnosis. But having been in the industry for quite some time, I've seen quite a bit. Here's what I see. Sure, there are probably people out there that do recommend treatment that patients don't need, and that is very bad. But if I were to guess, I would say that is a small, tiny, minuscule percentage of practicing dentists. The majority of dentists are good people. I know from working with them. And they don't recommend things or treatment, rather, that patients don't need. So why are patients walking out of offices saying, I went to so-and-so's office and they're recommending things I don't need? What's going wrong here? Well, here's what I've found. Usually when you see this, Dr. Smith has diagnosed this treatment plan for this patient, and clinically, in Dr. Smith's mind, this is what this patient actually needs, and then the patient walks off saying they were recommended treatment that they didn't need. What went wrong? It usually boils back to a communication issue, specifically two things. The first thing has to do with actually orienting or familiarizing a patient with your practice. So if I've come into your office, and some doctors do this real well, quite a few don't. It's a communication thing. I come into your office and I'm a new patient. I've seen your hygienist. I've had a full mouth x-ray, full mouth series of x-rays done. I've had perioprobing. You come in and you do some charting. You meet me for 5 minutes and you tell me the treatment that I need. You haven't actually really, you might ask me a few things about my past dental experiences, but you haven't really actually oriented me to what your office is all about. Why are you going to be recommending the treatment that you're going to be recommending? If your mission as a dentist is to truthfully restore someone's aesthetic, function, and health, that's really your mission. You see, maybe there's degrees of passion about this. Maybe you're really passionate about this. After all, there's plenty of studies that show how periodontal disease can affect adversely heart issues. There's also issues having to do with losing teeth and longevity. Someone's dental health actually affects their overall health. That's proven. So if you're really passionate about this subject, do you ever communicate this with your patients, especially a new patient? Now, how might something like that go? Well, I'm your new patient. You explain to me what your office is all about. Look, my mission is to restore, and you might figure out a nice way of saying this so you're not throwing me off with a bunch of terminology, but your aesthetic, your function in your mouth, and your health, and explain to me why you're doing these things and what this means and how it's important to you and how dental Dental health affects overall health, and this is the mission of your office. So when you're going to be recommending treatment, you're looking at what treatment is it going to take to restore those things to the best of your ability. Now you've oriented me as to why you're going to be telling me what I need. There's a purpose for it. Whereas if you were just to walk in and say, oh, Jeff, you need 6 crowns, well, why? My last dentist didn't say I needed 6 crowns. It's very important you have to give that mission or purpose to your patients so they understand where you're coming from, what your office is all about, what the character of your office is. Your staff should also be very familiar with this concept, and they should buy into it, because then, on top of everything else, you guys are a united team pursuing some type of a goal, but also it orients everybody to the idea of why you're doing the treatment that you're doing, especially the patient in these cases. That's the first thing. The second thing has to do with how treatment is communicated. So let's say you tell me I need 6 crowns. So, and this may have happened to you. I've seen variants of this happen many times over my career. And I tell you, well, doc, what's my insurance going to cover? You say, well, your insurance benefits will cover 2 of them this year. I go, good. Well, maybe I only want to do what my insurance covers right now. So then you say, okay, what just happened there? Let's take a look for a second. You told me I needed 6 crowns, and you very readily agreed to do only 2. What are you saying about those other 4 crowns? They're not all that important. They're so unimportant, you're willing to push them off to next year or the year after. Well, if I'm looking at you and you were so quick to drop those other 4 crowns we're supposed to be doing, what does that say about the 2 crowns you are recommending? Maybe they're not all that important either. This is probably the worst way to go about building up a relationship or trust with somebody, because I haven't even done any treatment with you yet, and I'm questioning what it is that you're doing. So maybe I tell you, you know what, let me think about these other 2 crowns, and I'll let you know later. So I walk out of your office, and what am I thinking? Well, I went in, I didn't realize he needed all this dental treatment. Now this doctor wants me to pay him $6,000? I'm back to exactly where I just started with this entire video. I think you're diagnosing treatment that maybe I don't need. Maybe I'm now going for a second opinion. Who knows? You see? Now, the other factor has to do with understanding the treatment itself. So you explain my treatment plan to me, and let's play this out when you're talking to a patient. You're explaining dental treatment, and then you're going over cost. Whether you do or somebody at your front does, you really should at least cover how much the treatment plan is going to cost, doctor. We talk about this in a lot of our training. But you've explained it to me, and you talk about cost. As a patient, if you don't really make sure I understand the dental treatment, what can you guarantee that I will always understand? I'm going to understand cost. Every one of your patients understands money, because we all deal with money. So you're explaining to me how much something costs, and I can't see the value because I don't even understand what it is that you want to do, and I just see cost. So again, what's going to happen? I'm going to walk out and wonder, I talk to my spouse about it maybe, why do they want to charge you so much? Again, why does this doctor want all my money? In a lot of cases, this is what creates those negative reviews, and because I've seen it from both sides. I've actually talked to patients on one end and the provider on the other, and I've seen that actually get created that way. It's because the patient doesn't understand, they don't understand the importance of the treatment, they aren't oriented to why it's important or why you're treatment planning the way that you do, and then the patient doesn't fully understand the treatment plan itself, and all they fixate on is money. So what could you start doing right now? If you have a mission statement or at least a purpose for your office, I would make sure that patients understand what that is. I would explain it to them and make sure that they understand that's where you're coming from when you recommend treatment. The other thing I would do is if you're recommending a treatment plan and a patient wants to pare it down, I wouldn't just immediately acquiesce. I would explain to them why you want to do it this way. Now, look, there are economic eventualities or realities, and maybe you can't do it all right now, but at least the patient understands why you want to do it all right now and what the importance of it is. The other thing is you have to make sure they understand what the actual treatment is and the underlying value associated with it. We cover a lot of this stuff and a ton more, just basic communication techniques, at the MGE Communication and Sales Seminars, which is 9 days of training on the subject. If you want a taste of some of our training on the subject of case acceptance, you could take a look at MGE's online training platform, DDS Success. You can get a free demo on there. Or you can come to one of our free seminars that we do all over the country called the Effective Case Acceptance Workshop. If you go to our website, mgeonline.com, you'll find it right there on the homepage. So I bent your ear for a little while. I hope this helps. If you'd like to know more about MGE, Don't forget to check out our website, mgeonline.com. You can also call us at 800-640-1140. And if you'd like to see other tips like this, don't forget to click the subscribe button and the little other icon. Looks sort of like a bell so that you get a notification every time a new video comes out. Thank you very much. We'll see you back again soon.